The issue is your patient doesn't know this. So what you need to do is to set expectations in the very first consultation. Hello clinicians and clinic owners. Thanks for coming back to another video. And on today's video, I'm going to show you exactly how you can retain patients after they're booked in. My name's Phil. I'm an ex-physio turned sales and communications coach, and I'm here to teach you how to become a better clinician and to solve your clinic problems. Okay, so let's paint a picture first. Let's just say you've got a patient called Violet. She comes in for back pain, and in the initial consultation, you've done an amazing job. You think you've treated her pain, she reports feeling better, and she's booked in a week's time to see you again. You don't think much of it. A few days go by, and Violet's name is still in your timetable. But then suddenly, the day before your session, Violet's name is gone. You quickly check the next week and the week after that, and Violet is nowhere to be seen. You don't know where Violet is, you don't know how her rehab's going, and you have no idea why she cancelled. Does that sound familiar? It sounds familiar because you've encountered it, your colleagues have encountered it, and if you're a business owner, then you see it on your sheets all the time. But if you want to solve this problem, you first have to understand the potential reasons why they might cancel from the client's perspective. Now, there are many reasons, but these are the 3 reasons that are most simple that you can address right away. The first reason is you did such a good job, they recovered so well that they become pain-free and they don't really think they need a physio anymore. Number 2, they didn't actually buy into your treatment. So although you may have felt that you did a great job, to your patient, you didn't really. So they really don't see the point of coming back to see you for the second time or the third time. And the last reason is simply that something happened in their life and they can't prioritize coming to see you for their rehab. Okay, let's start with the first reason. They recovered so well that they are pain-free and they really don't see the point of coming to see you anymore. This is very common, and the thing is, if their pain is gone, why would they want to come and see you? Can you blame the patient for thinking that you're not necessary in their life anymore because they have now recovered from their injury? You know rehab stops when range of motion, function, and strength has restored to previous levels or even more. The issue is your patient doesn't know this. So what you need to do is to set expectations in the very first consultation. For example, you want to tell them that they're likely going to be pain-free within a week or so. But being pain-free doesn't mean that you're now going to be fine. Being pain-free just means pain's gone, but you're still going to have range of motion differences and strength differences that you have to address over the next 2 to 4 weeks before the injured body part is now ready to be discharged. So when you do this, your patient will remember that, oh, I am pain-free now, but this doesn't mean my rehab is done because there's still going to be some weakness and some strength problems that I'm going to deal with. It's just that I'm not in pain anymore. Patients who know this are much more likely to attend their next appointment because they know even though they're now pain-free, their rehab is not complete. One of the simplest and also the harshest reasons why they don't come back for their second or third session is simply that you didn't do a good enough job. You need to treat your initial consultation like a sales process where you provide maximum value and maximum impact so that they get the wow factor and they know that they are in good hands. If you don't pay attention on how you're doing this, then you're really going to start seeing higher and higher cancellation rates. Now, there are 2 ways that you can address this right away. The first way is actually to have a really good sales process in your initial consultation. And if you want to learn how, I have another YouTube video that you can watch in the description box. The second way, which is very effective, is where you're checking with your patients 48 to 72 hours after their booking. Now, this is especially important if you have bookings that are spaced out a week in advance. So there's a lot of time between a session on Monday and a session on the next Monday. And you want to contact them roughly on the Wednesday or the Thursday to ask them how they're going and see if you can provide any extra value. Now, if they're on the fence about whether they want to come see you again, this little care factor will give you a little boost in the direction of wanting to come back and see you. If they didn't have any sort of cancelling and they want to come and see you, but you call them anyway, that gives them an extra level of perception on you. So it's a no-lose situation. And the third reason why one of your patients would cancel for no apparent reason is because something outside their life happens and they just cannot prioritize their booking. As the saying goes, sometimes shit just happens. The best thing to do at this stage is to give them a call and to inquire about their well-being, not to call because you want to rebook them right away. When you call about their well-being, your goal is to ask them how they are, and if it is within your scope, to provide more value. Because think of yourself as a patient first, okay? Let's just say that you went through a loved one dying and you've got an appointment with your chiro or your physio. You've had to cancel it because you've had to deal with a funeral, and your physio calls you and he says, hey, you canceled your booking. Are you going to rebook? You, as the patient, you're already dealing with the grief of losing a loved one, and now you're being accused of canceling a session, and this physio is pushing you to rebook. You are not going to have the capacity for that, right? But imagine instead, this is what happened. Your physio calls you. He says, hey, is everything okay? I saw you canceled your booking. You say, oh, look, I've just had some stuff happen. My family member died. We're just dealing with some grief at the moment. And then he says, hey, that's completely understandable. Look, I know you're going through a tough time right now, but you've still got some exercises that I wanted to show you. Is it okay if I email those to you? I'd say, oh yeah, that'd be very helpful. Thank you. And then I would say, okay, great. I'll email those to you. And do you mind if I follow up with you in a few days' time? I'll say, yeah, sure. Thanks. And I'll leave it there. And by doing that, the patient will feel cared for, and you as the clinician have delivered value by sending over that email. And you haven't asked them to rebook because you just heard that their family member has died. So it's kind of insensitive for you to want to book them into another consult. What happens after that is, because you asked them for their permission to check in with them in a few days, that's exactly what you do. And when you do check in with them, you ask them how their exercise is going, how the rehab's going, and at the end of that call, you make your ask. And do make sure that your ask is grounded in clinical reasoning. For example, you might say, now that we're at week 3 of your rehab, your pain and swelling are going to be mostly gone, which means that the focus now is going to be measuring your strength and range of motion with more advanced exercises. Would you be able to come in for those? And that's how you end the conversation. And it is because you showed that you cared about your patient first that they will most likely book in that second time. To conclude, booking retention is very, very important for your practice. Set expectations early that pain is not the end of rehab. 2. Leave no longer than 72 hours before you do some sort of check-in or follow-up with your patient. 3. When you check in or you call your patient, always focus on how you can deliver more value, not with the intention of rebooking them right away. If you use these tips, I guarantee you that you will be able to retain more of your patients.